Hello, everyone. Thank you for being here with us today, and welcome to Triage Cancer's webinar, Managing Side Effects at Work and in School. My name is Madison McMahon Ward, and I'm the Program Coordinator for Triage Cancer. I will be moderating today's webinar. Now, before we dive into today's topic, I just need to go over some housekeeping. All callers will be muted for the duration of the webinar. If you have any questions or technical problems, please type them in the questions box. This webinar is being recorded and will be available for viewing by the end of the week on our website, triagecancer.org. If you are calling in from a different phone number from the one that you provided at registration and you are not logged onto the computer, you may receive an email indicating that you did not attend. If you receive this email and you did in fact attend, please respond to it with the phone number you used to join the webinar. After today's session, you will be prompted to take the evaluation and will also receive an email tomorrow with the link to the evaluation. We would appreciate it if you could take a few moments to provide your feedback. We are very grateful to Pharmacyclics, Janssen, the California Dialogue on Cancer, Seattle Genetics, and Takeda Oncology for sponsoring the 2020 Triage Cancer webinar series. As part of the accreditation process for healthcare professionals, we have to read the following disclaimers and disclosures to you. This presentation is intended to provide general information on the topics presented. It is provided with the understanding that the author is not engaged in rendering any legal, medical, or professional services. The planners and presenters for this program have not disclosed any pertinent financial relationships or conflicts of interest. While this educational program has received commercial support from the previously listed sponsors, the content of the program has no relation to the commercial interests of the organization's products or services. I am pleased to let you know that Triage Cancer is an accredited provider for continuing nursing education by the American Nurses Credentialing Center's Commission on Accreditation. Triage Cancer is also approved to offer social work continuing education by the Association of Social Work Boards approved continuing education program. Therefore, nurses and social workers participating in the live webinar and meeting the following requirements may be eligible for one continuing education credit. In order to receive continuing education credit, you must have registered online for today's session. People who are listening in on someone else's computer are not eligible for credit. You also must attend the entire webinar. No partial credit will be awarded. Anyone watching a recording of this webinar is also not eligible for credit. Within 1 week of this webinar, complete the evaluation and post-test. You must receive a passing grade on the post-test to be eligible for credit. After the webinar, you will be redirected to the evaluation and post-test. And you will also receive an email tomorrow which will contain the link to the evaluation and post-test. Please note that on the evaluation, it asks for your name and email address. You must include these so that we can certify that you completed the evaluation. That email is the address we will use to mail the certificates, and we will be sending those out within 4 weeks. For other types of healthcare professionals, we are more than happy to provide a general certificate of attendance. Just make sure to indicate that request on your evaluation. And if you have any questions or experience any problems, email us at info@triagecancer.org. So now with that housekeeping out of the way, for those of you who aren't aware, Triage Cancer is a national nonprofit organization that provides education on the legal and practical issues that may impact individuals diagnosed with cancer and their caregivers. And I'm going to spend a few moments sharing some of our resources with you so that after today you have questions about other legal and practical issues that arise beyond diagnosis, you know where to go. And we provide education on practical and legal issues in a few different ways. We participate in events all over the country. Some of these events are hosted by our partners in the cancer community, and some are events we host ourselves. To see where we are going to be, take a look at our events calendar. Every year, we host 3 Triage Cancer conferences. This day-long event covers a variety of cancer survivorship topics. We welcome individuals diagnosed with cancer, caregivers, advocates, and healthcare professionals at this free event. For the rest of the year, we will be in Atlanta and Chicago, and registration is open for those. And at these events, we offer free continuing education for nurses and social workers. As you know, we host a monthly webinar series open to anyone in the cancer community. If you weren't able to join us for our past webinars or would like to hear the information again, remember that we post the recordings of all of our past webinars on our website. We also host 2 educational programs that are specific to healthcare providers. The first is our Insurance and Finance Intensive, and this is a comprehensive certificate program for oncology healthcare professionals and advocates on health and disability insurance and finances. We also have a full-day training on employment called Navigating Cancer, Work and Insurance that we deliver with Cancer and Careers. You can get more information and register for any one of these programs on our website under the Events tab. We have developed the Triage Cancer Advocate Training to train people who are interested in getting more involved in advocacy efforts on behalf of the cancer community. Advocates accepted into this program will gain advocacy skills, learn about key cancer-related legal issues that impact the cancer community, and will receive resources to take back into their own communities. We have rescheduled the advocate training to be on October 9th in Chicago, and we will most likely reopen the applications for the training later in the year. So you can stay up to date on this information by following the link that you see on the screen or by signing up for our e-newsletter. In addition to our events, we offer a number of educational and materials and resources online. Our quick guides are designed to be a snapshot of a particular topic, and they cover a variety of topics, and we are frequently adding new ones. We also have checklists and other documents designed to help with the legal and practical pieces of cancer survivorship. All of these documents can be downloaded for free on our website, or you may order hard copies of these materials on our website at triagecancer.org/material request. We realize that it can be challenging to find what you're looking for on the internet, so we compiled the contact information for some of the most frequently used state-specific agencies and resources on our site. And because where you live can impact what protections you have access to, we have charts of state laws on employment, disability, health insurance, immigration, estate planning, and more. Because we recognize everyone learns in different ways, we also provide educational animated videos on cancer survivorship topics. And we have videos on clinical trials, cancer survivorship care plans, health insurance, and employment topics. And these are available in English and Spanish, and stay tuned as we have more videos coming soon. We are also excited to say that we have several of our resources available in Spanish, including most of our quick guides and all of our animated videos. Again, these quick guides can be downloaded for free on our website. Cancerfinances.org is a site that we host in partnership with the SAM Fund that provides practical information on topics that can impact your finances. This website is designed to guide users to the information that is most relevant to their situation. We currently have modules on health insurance, disability insurance, education rights, estate planning, life insurance, and financial assistance resources, as well as a new COVID-19 module. More topics will be added soon. Triage Cancer and Citizen are partnering to give cancer patients an easy way to organize their complete health history free of charge. Citizen is a free online resource that helps cancer patients quickly and easily request their full medical records from all of their providers. It's very easy to sign up, and you can sign up at citizen.com/triagecancer. We believe that it's important for patients to make educated decisions about their treatment choices, and access to clinical trials may be an important option. So we have partnered with Emerging Medicine to have a clinical trials search engine available on our website. You can find that at triagecancer.org/clinical trials. And finally, our educational blog not only provides great information about cancer survivorship topics, but because things are constantly changing in the cancer community, this is how we share late-breaking news. And we have our monthly e-newsletter, which is where we announce all of our upcoming events. So with no further ado, let me introduce today's speaker, Monica Bryant. Monica Bryant is a cancer rights attorney, speaker, and author dedicated to improving access to and availability of quality information on cancer survivorship issues. Monica is the co-founder and chief operating officer for Triage Cancer. Throughout her career, Monica has provided hundreds of educational seminars, written articles, blogs, and co-authored a book published by the American Bar Association called Cancer Rights Law, an Interdisciplinary Approach. Remember, if you have any questions, please type them into the question box to the side of your screen, and Monica will answer them towards the end of the presentation. So with that, I'd like to turn it over to our speaker.
Thanks so much, Madison. Thank you all for being here today. So the topic for today is dealing with side effects at work and at school. But side effects is sort of a challenging thing to really nail down about what we're talking about, because there are different types of side effects for different treatments. Of course, everybody has a personal experience, and that's going to be different from somebody else. And it also means that the onset and severity of these side effects could be different. Now, some side effects may occur during active treatment and may subside once treatment is over. For example, the nausea during chemotherapy or pain during radiation. Some are going to be long-term side effects that might begin after treatment is over and can continue until all sorts of treatment are over. And chemo brain is a great example of a long-term side effect. When we talk about chemo brain, it's the term that we're using to describe the cognitive challenges that you may experience after cancer treatment. They could include challenges with short-term memory or an inability to concentrate, challenges with executive function or trouble learning new things. Of course, all things that are pretty important when we're talking about work and school. And then finally, there are late-term side effects. And these are going to be symptoms that may appear weeks, months, or even years after treatment ends. And that could include things like dental issues or bone loss or heart problems. So it's important when we're talking about side effects to be specific about what we're talking about and what you may be experiencing. Now, there are some overarching strategies to try to address side effects. And again, this isn't going to be a one-size-fits-all situation, and people may have to utilize several of these strategies to effectively deal with their side effects. And I sort of thought of these as fitting into two categories. They're the strategies that you probably need to engage your healthcare team in. So are there medications that you might be able to take to address the side effects, perhaps nausea or pain? Would an exercise regimen or physical therapy or occupational therapy be helpful? Would a specific nutrition plan be helpful? And of course, all the complementary therapies that are available now, things like yoga and massage and Reiki and acupuncture. But then there are also some pretty practical tips that might be useful if you're experiencing chemo brain. Try to task easier done. I think we're frequently multitasking, but to the best of your ability, trying to do one thing at a time and making lists and taking notes, certainly availing yourself of the organizational tools that exist. We have 2 webinars archived on our website from a professional organizer about dealing with the paper that comes along with a medical condition. And then certainly using technology. So would a smartphone or a tablet be helpful to utilize a calendar or reminders to pop up to have you do things? Or your Alexa, you can verbally ask Alexa to remind you in 10 minutes to go do something. So again, none of these are one size fits all, but it can be really helpful to kind of get back to basics as step 1 of trying to address side effects. But there are also legal protections that can help you deal with these issues. And we're going to start with work. And certainly anecdotally, we at Triage Cancer know that a cancer diagnosis and the resulting treatment can impact people's lives significantly. But the Institute of Medicine in 2007 released a report called Cancer Care for the Whole Patient, Meeting Psychosocial Health Needs. And the report really narrowed in on how there are psychological and social problems that are created or exacerbated by cancer, including disruptions in work, school, and family life. And those disruptions can cause additional suffering, weakened adherence to prescribed treatments, and threaten a patient's return to health. So we know that dealing with these side effects is incredibly important, and now we have the evidence from an incredibly established body to back us up. So side effects can obviously have a significant impact on an individual's ability to work effectively. And this is a serious problem in being able to keep your job and accessing income and possibly even your access to health insurance coverage. And certainly it can cause a lot of anxiety and stress about losing employment. And that's anxiety and stress on top of what you may already be feeling post-diagnosis and treatment. This is also an issue for people who really care about work and feel frustrated that they can't perform the way that they used to. And that frustration and anxiety, again, adds on top of everything else and can really have very serious mental health consequences. So we really feel very strongly that employees who've been diagnosed with cancer understand their employment rights and what's available to them. So in this next section, we're going to talk about the rights and policies, certainly the federal and state laws, and then how the law is a tool for you to be able to either work through treatment or return to work and be the best employee that you can be. But if all of those things weren't challenges enough, we often find that employees are battling assumptions. So they could be battling assumptions of their own that post-diagnosis and treatment, they cannot work and there's nothing that's available to help them. They could be battling their employer's assumptions that their employee can no longer work and there's nothing that can help. And we often hear that they're battling the assumptions of their healthcare professionals that have these feelings that the patient can't or wouldn't want to work, so they should just go out on disability leave. And the reality is that these assumptions sometimes push employees out of work or towards disability insurance, and then their income drops, which then impacts their finances and could impact their health insurance coverage and their overall health. So for us, it's very important to empower everybody in the conversation to know what may or may not be available to employees who are dealing with a cancer diagnosis. So there are a couple of places that we can go to figure out what our rights are in the employment context. There are fair employment laws, both federal and state, and these are going to deal with discrimination protections and possibly provide reasonable accommodations, which we'll talk more about. There are leave laws, both federal and state. And then if you're an employee working under an employment contract or you're a member of a union, that contract may provide you additional or different rights and benefits. And so it's very important to make sure that you understand what's in your specific contract. And throughout this section, you're going to see links on the slides to our quick guides and our charts of state laws so that you can find more information about all of these different benefits. And tomorrow, or at least by the end of the week, on our website, there will be a clickable document for you to be able to click all of these links as well. Now, the law is just the bare minimum of what employers have to provide. But the reality is that many employers are in fact more generous than that bare minimum. So it's critical to also look at your employer's specific policies and benefits. Now, typically this information would be included in some sort of policy and procedures document or employee handbook. I fully recognize that not every employer is going to have something formalized and spiral bound like what we've shown you here. Sometimes it's electronic documents, sometimes it's not even written down at all. So you may have to do some digging and ask some questions to get this information. But some of the things that you're going to want to look for are, what are the benefits offered to employees? So that could certainly include types of insurance, so health, dental, vision insurance. Do you have access to a disability insurance policy or maybe a life insurance policy? What other benefits does the employer provide? Do they offer sick time? So in most states and location, if you are eligible for sick time, that's through an employee benefit, not through a law. Do you have access to vacation time or other types of paid time off? Maybe your employer has a policy where they allow employees to donate their paid time off for a sick employee or colleague to pull from. Maybe there's already a system in place for telecommuting or job sharing. So many employers have these types of benefits, and often we don't know what those are until we need to use them, and then sometimes we are running behind the ball. So it's valuable to understand what your employer offers. And then certainly a great policy and procedures document would have a process laid out for how an employee could request medical leave or request a reasonable accommodation. Now, you may be thinking, well, wait a minute, I don't have one of these documents. Who would I ask? Maybe you have access to an HR representative, or you could ask whomever at your job deals with things like payroll. They should have answers to these questions. So getting into the first law that we're going to talk about to address side effects, one of the most important legal tools is the Americans with Disabilities Act. Now, many people who are diagnosed with cancer don't consider themselves to have a disability, and therefore they don't think they're protected under the ADA. But this is one of those situations where I really urge people not to get caught up in the labels. Otherwise, you may end up missing out on protections. So the ADA is a federal law that prohibits discrimination against people with disabilities in several contexts. Title I is where we're going to be looking for protections in the workplace. But not everybody is going to be eligible for protection under the ADA. There are a few hurdles that an employee is going to have to clear. So first, they have to work for a private employer with 15 or more employees, or work for a state or local government of any size. Now, if they work for the federal government and they're a federal employee, they're instead likely to be covered under the Rehabilitation Act of 1973. Which is very similar to the ADA in its employment protections. The second hurdle that a patient would have to clear is making sure that they're a qualified individual. Legally, that means that they are a person who can perform the essential functions of the job with or without a reasonable accommodation. Practically speaking, what that means is that you're qualified for the job in question and you can perform the major essential job responsibilities. But you can get help to do that through this thing called a reasonable accommodation, which I promise we're getting to. And then the last hurdle that you'd have to clear is you'd have to have a disability within the ADA's definition of a disability. Now, if you've ever heard us at Triage Cancer speak before, you know we use this word disability quite often, but it's important to remember that every law we talk about potentially has a different definition of disability. So under the ADA, a disability is a physical or mental impairment that substantially limits a major life activity. And I realize that's a lot, so let's break it down. The first part is that you have a physical or mental condition. The second is that physical or mental condition is limiting something called a major life activity. And it's limiting it substantially. So what's a major life activity? It's going to be anything that the average person in the general population can perform with little or no difficulty. So we're talking about things like sleeping, walking, breathing, concentrating, the operation of major bodily function. These are all going to be considered major life activity. And when we're talking about cancer, oftentimes it's not the cancer diagnosis itself that creates the disability, but rather it's the side effects from treatment that somebody's experiencing, like that nausea or chemobrain or fatigue or anxiety. And it could be that one of those side effects all by itself is substantially limiting, or it could be that it's a combination of all of those things that gives rise to the presence of a disability under the ADA. Now, one important thing to remember when thinking about if somebody has a disability under this definition is that we're looking specifically at an individual and how their medical condition is affecting them. In other words, we can't just blanketly classify all people as having cancer with a disability. So once that we've shown that somebody's qualified and has a disability under the ADA, there are 4 ways that somebody can actually use the ADA's protections. So first, if you currently have that physical or mental impairment that's substantially limiting a major life activity. So maybe you're in the midst of active treatment, you're going through chemo, and you have severe nausea every day. The second is that you have a history of having that impairment. So maybe you're 5 years out of active treatment, but you are experiencing some of those late or long-term side effects. The third is that you're being regarded as having a disability. And this really isn't about your experience or capacity at all, but rather it's about the employer's perception of you. And the employer is perceiving you as having a disability and therefore treating you differently. And then finally, the fourth way that you may be protected is based on an association with a person with a disability. And this is where caregivers may be able to be protected from discrimination under the ADA. Now, what's really interesting about the ADA is that it applies to all phases of the employment process, which means it doesn't just provide protections once you're an employee, but it also provides protections when you're a job applicant. So even before you get the job, you could be protected under the ADA. So if you figured out that you qualify under the ADA, what does it actually give you? In all of these circumstances, so you currently have a disability, you have a history of having a disability, you're being regarded as having a disability, or you're a caregiver, you are protected from discrimination, which means that employers cannot be making employment-related decisions based on your medical information. Now, if you currently have the disability or you have a history of having a disability, in addition to being protected against discrimination, you are also entitled to a reasonable accommodation. Now, I do just have to mention that in addition to the federal ADA, there are state fair employment laws. Most are very similar to the ADA, but the state laws can actually be more protective in certain circumstances. So sometimes it's a broader definition of disability. Sometimes it specifically lists cancer, which in my mind kind of makes that hurdle a little lower to the ground and easier to jump over. But perhaps most significantly, what the state fair employment laws do is they can cover smaller employers. So this chart shows the number of employees each state fair employment law requires the employer to be covered under the state law. So as you can see, Illinois is in the column for number 1, which means in Illinois, the employer only has to have 1 employee to be protected under the state fair employment law. California requires 5 employees. Now, if you don't see your state listed here, it means that it's the same as the federal law and requires 15 or more employees. So this is particularly useful information for someone who may work for a smaller employer and may not be covered under the ADA. They should be looking to their state fair employment law. And more details about the state laws can, of course, be found on our chart of state laws. Next, we're going to get into reasonable accommodation. Now, the legal definition of a reasonable accommodation is any change in the work environment or in the way that things are customarily done that enables an individual with a disability to enjoy equal employment opportunities. Now, I recognize that that's relatively vague and possibly confusing verbiage, so the best way for me to talk about reasonable accommodations is with some examples. But before I get into the examples, I have to just say that in my opinion, reasonable accommodations are really the most useful tool for individuals who are trying to work through treatment or return to work after treatment, because they are incredibly flexible and powerful. So let me explain why. Generally speaking, accommodations can be put into 3 different categories. The first category is about work space. This is about your physical space. And it could be maybe you need brighter or dimmer lights in your workspace if you're having a light sensitivity issue. Or maybe you need a special chair, or you need to switch offices because you're having a hard time concentrating and you're in an open floor plan. It could be about having a closer parking spot. It could also mean telecommuting. Now, telecommuting, obviously, many of us are doing more of that right now, but prior to COVID-19, there were sometimes people who were or employers who were resistant to telecommuting. But it doesn't necessarily have to be about working from your home. It could be about working from another location. So is there a conference room closer to your home that you could work from that's quieter or eliminates a commute? So telecommuting is a very powerful, reasonable accommodation for some jobs. Now, the second bucket is about schedule. And this could be about maybe going from full-time to part-time, or maybe it's about a flexible schedule. So maybe instead of 5 8-hour days, you need to work 4 10-hour days. So same number of hours, just rearranged differently. Maybe it's about when in the day you're working. So do you have the type of job where instead of working 9 to 5, you can work 7 to 3 because you're better in the morning than you are in the late afternoon? It could be about changing your breaks. So if you get 3 15-minute breaks and a 30-minute lunch, can you split up that 30-minute lunch so you end up with 5 15-minute breaks instead, or some variation thereof? It could also be about extended leave, which we'll get to. And then the last category is sort of everything else. It could be about using technology. So for example, if somebody's experiencing neuropathy or pain in their hands and their job is a lot of typing, maybe they can get speak type software. Or maybe it's about getting special permission to record staff meetings so that you don't have to worry about forgetting something that was said and you can just participate in the meeting. It could be about a change in policy. So if there's a policy that there's a very specific dress code at your job and you're experiencing temperature sensitivity, maybe you can have an accommodation of being able to wear an additional jacket. So policies can be amended or changed for that one employee. It could be about shifting responsibilities. So if you remember, I talked about the idea that you have to be a qualified individual, which means you can perform the essential functions of the job. But how many of us do just the essential functions of our job? Very few of us. We are often asked to do much more than those essential functions. So as an accommodation, perhaps those non-essential functions can be shifted to another employee. For example, school teachers are often asked to supervise the bus drop-off line and recess in addition to their classroom teaching duties. Well, if a school teacher is dealing with fatigue, perhaps those bus and recess duties that are not really essential functions of teaching can be shifted to other employees. It could also mean a change in position entirely. Now, this only works if the employer has a vacant position that the employee is qualified for. So an employer is not required to create a new job for an employee as an accommodation. Now, I've given you some examples, obviously, but it's not going to work for every person. And you may be sitting there thinking, there's no accommodation that would work for me. And in fact, I get a lot of phone calls of that, of saying, I know you talk about reasonable accommodations, but nothing's going to work for me. But usually what is helpful is really digging down into what does your job require and what's the issue and what types of things might be helpful. And one starting place in that conversation is to use the Job Accommodation Network, or JAN. JAN is an entity that's funded by the US Department of Labor, and their entire purpose is to help employers and employees figure out possible reasonable accommodations. They have a searchable online accommodation resource, otherwise known as SOAR, and it allows people to explore various accommodation options with individuals who have different types of medical conditions and who work in different workplace settings. So you could put in that you're a school teacher and you're experiencing fatigue, and it will pop out accommodations that other people have actually gotten. And it can be a way to sort of start the thought process. You might think, well, that wouldn't work for me, but it might spur another idea. So in addition to providing that source system, the Job Accommodation Network has lots of other tools on its website. And they also do a study every few years on the impact versus cost of accommodations. And this is really interesting to me because one of the things that I hear repeatedly in our work is, you know, my employer's been really great and I hate to go in and just ask for one more thing. Or from employers, listen, I want to do what's right and I want to help my employees, but I'm really concerned that these accommodations are just going to cost so much that it's not going to be feasible. So the Job Accommodation Network does this study, and what they find is that the cost of accommodations, when they ask employers how much did providing the accommodation cost you, 58% of all accommodations cost the employer absolutely nothing. So think about my example about the person who has temperature sensitivity and needs to wear a coat, and that's outside of dress code. That doesn't cost the employer anything. Or the person who needs to record the staff meetings with their cell phone. That doesn't cost the employer anything, but has a huge impact. Now, in the same study, they found that 37% of the accommodations did have a one-time cost, typically of around $500. So again, not astronomical amounts of money. But what was really interesting about this study is they dug deeper and they found that 83% of the employers who called JAN for help were doing so because they wanted to keep or promote a current employee. So they're really looking for ways that they can help their employees. And I think that that's a really valuable thing for the employees to keep in mind, that this isn't always an adversarial process. Also, we know that accommodations are mutually beneficial. They are not just useful for the employee that's receiving them, but they also help the employers. And they do so by making sure they get to keep a valued employee, or they increase the employee's productivity, and they avoid spending extra costs and dealing with absences. So I spend some time talking about this because I really want to empower any employees who are on today to think of accommodations as something that is mutually beneficial to both you and your employer. But the fact of the matter is, employers that are bound by the ADA are required to provide eligible employees with accommodations, unless they can show that providing that accommodation would be an undue hardship or a direct threat. So it's a very, very high bar for the employers to have to clear in order to say that they can't provide the accommodation. But it doesn't mean that anything the employee requests is going to be granted. Ultimately, it is the employer's final decision to decide what is going to be the reasonable accommodation. Because accommodations have to be both reasonable and effective. It may be unreasonable to require that an essential function of the job be taken out of the position, or it may be an undue hardship to request something that would significantly impact the ability of the business to operate. So for example, if the accommodation is requesting a job sharing situation, but it's a small business that only has 3 employees, that adding another employee with all of those extra costs may be considered an undue hardship. So all of these things are going to, again, be very dependent on the employer and the workplace and the employee's role. The other thing about reasonable accommodations is it's not a one-time, one-size-fits-all situation. So it may be that you need more than one accommodation to deal with all of the things that you're dealing with. Now, if you remember, I said that caregivers are not legally entitled to accommodations under the ADA. But the same principles that I just talked about in terms of being beneficial for the employer apply when it's the employee who has their own cancer diagnosis, or if the employee is acting as a caregiver. So in my mind, this falls under that it can't hurt to ask, even though you're not legally entitled to it as a caregiver. Now, I mentioned a couple times how important I think reasonable accommodations are. And because of that, we've created several resources to help you. So we have a quick guide, we have a checklist, and we also have one of our short animated videos on dealing with side effects, which talks about these reasonable accommodations. Now, asking for an accommodation brings up a number of questions about how you might actually go about doing that. Generally, an employee should ask for an accommodation as soon as they realize they need one. Because if you don't ask, and whatever you're coping with starts to impact your job performance, then the employer may end up making decisions like demotions or even firings based on your job performance. So how do you ask? You don't have to invoke the ADA or specifically use the words reasonable accommodation in order for your employer to be obligated to provide the accommodation. An employer really should understand what you're asking for. That being said, we often see employees in the position of being the educators to their employers about what reasonable accommodations are. And again, Jan can be a really good resource for that. Now, when asking for an accommodation, who you are going to ask at your employer could be tricky. Generally, I recommend that the first step is you check that employee manual to see if your employer has laid out a process. If they haven't, then it could be your supervisor, it could be the HR person. Again, this is going to be very job specific. I do want to mention that requests for reasonable accommodations should be kept confidential, but that's not a guarantee that only the person you've spoken with is going to get that information. Because if you ask your supervisor may actually have to take it up the chain to HR to get approval for it. Or if you ask HR, your supervisor may have to be made aware that you're getting a reasonable accommodation. But they shouldn't be sharing all the information specifically about your medical condition, just that you're getting a reasonable accommodation and what the reasonable accommodation is. Now, the interesting thing about reasonable accommodations is, again, they're very flexible and they can change over time as your needs change. Because what you might need in the midst of active treatment could be different than what you need a year out of active, 5 years out of active, 10 years, etc. But regardless of where you are in this process, employers and employees have to engage in something called the interactive process, which is just a term that the EEOC uses to describe the back and forth conversation that has to occur and the ongoing monitoring of the reasonable accommodations. So it can't go like this. Employee says, employer, I would like to telecommute. Employer says, no, period. What it is go like something like this. I would like to telecommute. Employer says, I'm sorry, you're a school bus driver and we don't have that technology yet, so you can't telecommute, but maybe what you could do is just work the morning shift. Employee says, working the morning shift would be helpful as long as I could also have every Friday off for my chemotherapy. Employer says, okay. And then at a reasonable time, there's a reassessment of if that reasonable accommodation is effective for what the employee is going through. Now, over time, we've found the need to talk about medical marijuana because more than half the states now have medical marijuana laws, and about 10 of the 11 states have passed legislation allowing full legalization laws for marijuana. However, it is still illegal under federal law to use marijuana, whether it's medical or not. And this has created a lot of challenges for individuals who are using medical marijuana to alleviate the side effects of treatment. And they're doing so thinking that they're protected under their state laws, but they could still face some repercussions under federal law. And one of those potential repercussions is they could potentially lose their job because employers are still allowed to have zero tolerance policies. So they can let somebody go for using an illegal drug because it's still illegal under federal law. Now, there are some differences in states and how they approached medical marijuana under their state statutes. But again, the reason we're talking about this in the context of employment is because somebody could potentially lose their job if there was a zero tolerance situation. But some patients have tried to argue that their employer should be required to accommodate their use of medical marijuana as a reasonable accommodation under the ADA. So far, no federal courts have agreed with that argument. However, there are a few states that have written into their state statutes that employees cannot be negatively impacted by their use of medical marijuana specifically. So states like Arizona and Connecticut and Rhode Island. Again, this is sort of one of those areas where the law has been slow to catch up, and there's a very odd federal and state clash here, and there isn't one good, great, clear answer. We just want people to know if they are considering using medical marijuana, it could potentially have repercussions at work and at school. And so to understand those repercussions before they move forward. Now, even though I have, I think, extensively touted the importance of reasonable accommodations for working through treatment, sometimes we're going to need to actually take some time off from work. And the FMLA, or the Family Medical Leave Act, is the federal law that allows certain employees to take job protected and health insurance protected leave as a way to mitigate side effects from work. And that can be particularly important if we're using the FMLA as intermittent leave or for things like days when you're not feeling well. Now, for the sake of time, I'm not going to do a deep dive into the FMLA, but know that we have several resources on our website, including a quick guide to the FMLA and a recorded webinar about taking time off and how to pay for it. I also want to briefly mention some of the new protections that have been created as a result of COVID-19, because now there are some additional options to take leave that have been created separate from the Family and Medical Leave Act. Under the Families First Coronavirus Response Act, which is one of the three main pieces of legislation that has been passed federally, there is an option for paid sick leave. Now, this is definitely an expansion from the FMLA, which is unpaid, but it's paid sick leave for relatively narrow reasons. And this chart shows the qualifying reasons for sick leave and the various amounts that somebody might get paid based on their reason for leave. But we've been getting a lot of questions lately about this self-quarantining provision. So many individuals who have been diagnosed with cancer have compromised immune systems and have been advised to maybe stay at home because they're afraid of contracting COVID-19. Unfortunately, that would not be a qualifying reason under this particular law for paid sick leave. Self-quarantining in this context is if somebody has already been exposed they are told by a healthcare provider to self-quarantine so that they don't expose others. So unfortunately, this isn't going to be a great solution for those people who are really just trying to protect themselves based on their compromised immune system. Now, the other new provision is about the FMLA, and it's about paid family leave if somebody's acting as a caregiver for a minor child whose school or childcare has been closed. So again, this isn't a super broad paid FMLA. Now, I recognize there's probably going to be a million questions about these new laws for understandable reasons. Yesterday, my colleague, Joanna Morales, hosted an hour-long webinar and did a deeper dive into these changes. That recording will be on our webinar, that webinar recording will be on our website by the end of the day. And again, more information can always be found in the Triage Cancer blog. So meet Thomas. Thomas is a nurse at a local hospital and he's been working through treatment. The hospital he works at informed him that he will be reassigned to a COVID unit starting tomorrow. He's concerned about COVID exposure given his compromised immune system, and he's trying to figure out what his options are. This has been a really common scenario lately, and it's not just at hospitals, but the laws and the protections that we've discussed already are still applicable. So he's going to have to figure out if he needs to take time off and then not work. If so, we're talking about taking leave under FMLA or the state law potentially. If he's asking for a change in his workspace, so staying on the non-COVID floor or moving to an administrative role, or maybe providing telehealth, that type of request is going to be an example of a potential reasonable accommodation. So again, this is all sort of quickly changing. We're in uncharted waters. The landscape is changing day by day, but more and more employers are having their employees telecommute or work from home. That's going to be harder in certain professions. And so people are going to have to be pretty creative. And then again, access the information as we are putting it out. Now for switching gears quickly into dealing with side effects at school. Again, there are a few places to look for students' rights and benefits. There's going to be federal laws, primarily the IDEA or the Rehab Act or the ADA. There are going to be state laws, and quite a bit of educational policy is decided at the state level. And then finally, you're going to have to look at your specific school or district's policy, because school districts are, again, just like employers, allowed to go above and beyond what the bare minimum of the law requires. Now, when we're talking about side effects in children, adolescents, and young adults, it's again very similar in that different treatments are going to have different side effects. Different people are going to react differently. Depending on the age of an individual, they may have different issues. The one thing that I think is significant to mention when we're talking about children is that their brains are still forming. And so they can have significantly greater impacts into things like handwriting and spelling and vocabulary and concentration and the ability to complete tasks on time. I mean, certainly those things are hard for children generally, and then you add these side effects of cancer treatment on top and it can become incredibly challenging. So the first law we're going to talk about is the Individuals with Disabilities Education Act, or the IDEA. And this law is going to require public schools to provide free and appropriate education in the least restrictive environment. So we're talking about kindergarten through 12th grade, but that can actually go up to age 21. And that does happen in the case of some childhood cancer survivors. If they've had to be held back because they've missed too much school, you may end up with a 12th grader who is older than maybe the typical 12th grader. Now, there are 13 different qualifying disabilities that would enable somebody to avail themselves of the protections in the IDEA. Oftentimes, when we're talking about children with cancer, they're going to fall under that category of other health impairments. Now, for more information, the Department of Education's website does have some useful information. But under the IDEA, a parent must request an evaluation of their child for what's called an Individualized Education Plan, or an IEP. If a child is determined to be eligible for services under an IEP, then they're going to create this document all together, and it's usually school staff and parents, and sometimes even the child is involved in creating the IEP. And then once that plan is created, it is actually signed by all the participants, and it becomes a legal document that by law has to be carried out as written. And then the goals and objectives of that IEP are going to be reviewed annually and rewritten as necessary. So again, very similar to what we talked about in the work context, there has to be that ongoing assessment of if the IEP is actually is in fact effective. Now, Section 504 of the Rehabilitation Act of 1973, which is often just talked about as, a 504 plan, is clarifies that no individual with a disability can be excluded from participation or denied benefits under any program receiving federal funding. So we're talking about all kindergarten through 12 and college and graduate schools who are receiving federal funding. The Rehab Act actually has a broader definition of a disability than the IDEA, and you can see it's very similar to the ADA. So we're talking about students with physical or mental impairments that substantially limit one or more major life activities. And it also helps individuals who have a record of having such an impairment, so that's similar to the history prong of the ADA, or students who are perceived as having such impairment. So again, very similar to the regarded as prong under the ADA. Now, what I always find interesting about Section 504 is that the disability doesn't necessarily have to adversely affect school performance in order to be able to receive services. And those children don't have to come under the umbrella of special education. So any individual who's diagnosed with cancer is eligible to receive services under Section 504. And it's going to be a similar meeting to that of an IEP. The needs and then services are written down, and then it's called a 504 plan. The difference is, unlike the IEP, a 504 plan is not monitored for compliance and doesn't have to be reviewed annually. Now, the ADA applies in this context as well. And so there are going to be reasonable accommodations that might be helpful for students. And again, you'll see very similar categories. It could be about space. It could be about modifying schedule. One of the schedule modifications that I find really interesting is letting a student leave class early to get to the next class so that they don't have to walk the hallways with all the other students that could cause, anxiety or bumping into other students. They can go while the hallways are empty. It could be about using technology, so a calculator, typing notes, having a note taker, course load exceptions. So there are a whole range of reasonable accommodations that might be useful in the education context as well. Now, in both work and school contexts, when thinking about accommodations, it's always helpful to start with this checklist. And this is a pared down checklist. The full version is available on our website at the link that I've provided. But again, it's a starting point for everybody to make sure they're on the same page. Now, one of the most common questions we get in the area of work and school in cancer is, do I have to disclose my diagnosis to my potential employer, or my employer, or my school? And the answer is generally no, but you are going to have to disclose some information in order to use the discrimination protections, access reasonable accommodations, request medical leave, or to get some of these educational interventions, because the entity that's providing these things is entitled to know if someone is in fact eligible or not. Now, we have additional resources on this, including a quick guide and a webinar that I recorded last month, I believe, on our website that does a deeper dive into disclosure. But generally speaking, we talk about this because there's no standard form or set of requirements for what people disclose under the ADA or even in the education context as well. But we do want people to think through disclosure because it's a personal decision. And in a time when so much control is taken away from an individual, we want them to have some control back in knowing that they may not have to disclose everything in order to access these protections. Now, we have some, although it's not the topic of today, some education-related financial assistance options laid out on Cancer Finance and, cancerfinances.org. And we've recently released a blog that has some information about loan deferment related to COVID-19. So if someone has financial questions related to education, that might be helpful. And then certainly, as I mentioned, we have lots of resources, and these will all be available on our website as a clickable document by the end of the week. Now, on cancerfinances.org, in addition to the financial pieces, we have a whole module on education rights that talks quite a bit about what I've talked about today. And what's unique again about this site is that people can answer some basic questions and it will take them to the most tailored information. So I know I'm right up against the hour, but I am actually not seeing any questions in the Q&A box. So there was a question about the job accommodation network and the searchable system. It is at askjan.org, and it's the SOAR, S-O-A-R system. And I believe if you click for employees, it's just right there on the askjan.org website. So for the sake and respect of everybody's time, I'm going to turn it back over to Madison to talk about the CE process again. But if you do have a question that I wasn't able to get to, or a question comes up later, you can always contact us via our email at info@triagecancer.org. So Madison, I'll turn it back over to you.
Great. Thank you, Monica, so much for that presentation. Before we go, I just want to remind everyone of the continuing education credit information. So in order to receive credit, you must have registered online for today's session. People who are listening in on someone else's computer are not eligible for credit. You must have attended the entire webinar. No partial credit will be awarded, and anyone watching a recording of this webinar will also not be eligible for credit. Within 1 week of this webinar, complete an evaluation and post-test. You must receive a passing grade on the post-test to be eligible for contact hours. You will be redirected to the survey once this webinar ends, and you will receive an email tomorrow, which will contain the link to the evaluation and post-test in case you are not able to complete it today. Please note that on the evaluation, it asks for your name and email address. You must include these so that we can certify that you completed the evaluation. And that email is the address we will use to mail your certificates, and you can expect certificates within 4 weeks. For other types of healthcare professionals, we are more than happy to provide a general certificate of attendance. Just make sure to indicate that request on your evaluation. And if you have any questions or experience any problems, email us at info@triagecancer.org. And I want to thank everyone for joining us again today, and we hope that you found this presentation useful and will continue to stay connected with Triage Cancer. Thank you.